من أهداف التنمية المستدامة المتعلق بضمان حياة
especially goal 3, which is related to the insurance of healthy life, not to mention the UHC. Thus, all governments and all development partners have to work towards rapid and comprehensive solutions for the strengthening of preliminary and primary health as one of fundamental human rights and decent life. In this regard, I would like to reiterate that the efforts in pursuit of UHC will never be completed and achieved unless we manage to achieve full coverage of medicine and to forge partnerships between pharmaceutical companies and governmental institutions in order to provide all with medicine and health care and to promote international cooperation at times of health crises. In this regard, I would like to recommend and to commend the next 5-year plan of the WHO 2019-2023, which focuses on healthcare for all. Ladies and gentlemen, throughout the last recent years, Egypt has given priority to the health of her citizens, and we started the campaign of 100 million health, especially on virus C and incommunicable diseases. And so far, we managed to examine almost 60 million Egyptian citizens within less than 1 year, in addition to disbursement of medicine for free through governmental and public outlets for more than 1 million citizens who were discovered to have sustained virus C. And actually, this was acclaimed by the WHO through its investigation team. And through this, the report, which was tabled to the WHO during August, and we started the last phase of UHC for all Egyptian citizens. And we have myriad initiatives in this regard. We have, for instance, the initiative to put an end to the waiting lists for surgeries, which included maybe more than 250,000 patients so far, not to mention other campaigns to shed light on the health issues of women and children in Egypt, especially through the two initiatives, the support of the women's health as well as the discovery and treatment of the of hearing impairment for newlyborns, in addition to the obesity-related diseases at schools. Ladies and gentlemen, we did not stop short at the national level only when it comes to health care. We have extended our efforts to cover the African continent through the priorities of our presidency of the African Union, and currently we are generalizing and mainstreaming the 100 million health campaign throughout all the African countries in collaboration with the WHO within the agenda of the AU for development of 2063. Our meeting today is a new opportunity to renew the international commitment to strengthen universal health care all throughout the globe on the basis of economic development and social sustainable development for all, instead of depending on aids and grants, and this will only be achieved by coordination of efforts at the international level. And the political declaration emanating from our meeting today is a landmark in the international efforts in pursuance of UHC for all peoples and societies. And thank you very much.
I thank the President of the Republic of Egypt on behalf of the African Group, and I now give the floor to His Excellency Uhuru Kenyatta, President of the Republic of Kenya.
Your Excellencies, Heads of State and Government, the President of the 74th Session of the UN General Assembly, Director General of WHO, distinguished ladies and gentlemen, my government's Vision 2030 aims to transform our country, Kenya, into a newly industrialized middle-income country, providing a high quality of life to all her citizens by 2030. We believe that improving the health and welfare of citizens in their lives guarantees our economic growth and competitiveness by ensuring healthy, productive populations. The attainment of universal health coverage by 2022 is one of 4 big agenda of my administration. Focus is on ensuring access to affordable, quality health services as a basic for ending extreme poverty, improving productivity, especially in low-income and middle-income areas. In December of 2018, I commissioned a pilot of the universal health care implementation, targeting a population of 3.2 million to inform its national scaling. In its 9th month now, the pilot focused on investment in strengthening primary health care, and it has been instructive in identifying best practices, lessons, and gaps in implementation. Let me share with you some of the key lessons and best practices in our journey towards UHC. First, political commitment is essential to the success of universal health coverage. This commitment must embody a shared vision of all political leaders in the country and actors, especially in counties with more than one level of government like Kenya. Furthermore, the commitment will only be impactful if translated from a shared vision to collaborative action. Second, the largest dividend that can be gained from political commitment is the mobilization of community and citizen ownership of universal health coverage. Indeed, the principle of leave no one behind needs to resonate with each and every citizen, thus reinforcing the much-needed social accountability for the success of service delivery in all interventions. Third, the harmonization and alignment of all action and interventions by health sector actors, where local, national, and international is absolutely necessary. Sustainable impact and efficiency gains can only be accrued from an alignment and synergy of action as articulated in the Global Aid and Development Effectiveness high-level fora in Paris, Accra, and Busan in the years 2005, 2008, 2011, respectively. Fourth, we are cognizant of the indivisibility and interdependence of health system interventions. While a great impetus is placed on financing of healthcare systems, we have learned that progress towards universal health coverage will require an integrated whole-of-government approach and a health system-wide approach. Lastly, and perhaps for me the most significant lesson, is that citizens respond. Health-seeking behavior has improved. There was a demonstrable increase in health facility visits as well as admissions. This, therefore, has reaffirmed my government's commitment to soldier on and make further investments in affordable health care. It continues to be a work in progress, and we are inching closer to the leave no one behind, with a special focus on the most vulnerable in our society. Ladies and gentlemen, my government will continue to implement health care in a whole-of-government approach, seeking to leverage lessons learned and to capitalize on the devolution of health services, which has provided an opportunity for the implementation of health services that are people-centered and responsive to their needs. This meeting presents us with an opportunity to once again renew and galvanize our political commitments while creating more partnerships towards the realization of universal health coverage for all. My government looks forward to creating partnerships, realize major capital investments in health, while at the same time focusing on basic primary healthcare services and finding ways of integrating cost-effective technological advances in providing care, even at the lowest level. I wish to reiterate the support and commitment of my government to contribute to global efforts towards the achievement of universal health coverage and all sustainable development goals. I once again thank you for your attention.
I thank His Excellency Uhuru Kenyatta, President of the Republic of Kenya, for his statement. I now give the floor to His Excellency Paul Kagame, President of the Republic of Rwanda. President Kagame, please.
President of the General Assembly, Secretary General, Director General of WHO, Excellencies, Heads of State and Government, distinguished delegates. Universal access to health care is a defining feature of the modern social contract. Good health affords people dignity and enables them to use their talents to the full. Today, we renew our joint commitment to affordable care. No parent should have to choose between food and medicine for their families. Innovation, domestic resource mobilization, and international partnership are the key strategies for making healthcare accessible to everyone. Allow me to share some examples from Rwanda's experience. First, we have expanded our network of community health workers from 2 per village to 4. That translates into 1 worker for every 40 households, helping to ensure that no one is left behind. Second, to improve equity in access, Rwanda set a target that the walk to the nearest health facility should be no more than 25 minutes. Half the country now meets this standard, and the work continues. Third, 93% of Rwandan girls below the age of 13 have received the human papilloma virus HPV vaccine. This highlights the importance of gender equity as well as the urgency of including treatment for non-communicable diseases such as cervical cancer. Health insurance is the foundation of our policy framework. More than 90% of the Rwandan population is now covered with a mixture of community-based and private schemes. Of course, barriers to achieving high-quality universal health coverage persist in Rwanda as well as elsewhere around the world. It is the responsibility of everyone gathered here to take the lead in addressing these gaps and leave behind a legacy of universal health coverage for future generations. It is possible. I thank you for your kind attention.
Well, so there's 2 presidents there from Africa speaking on this issue of universal healthcare. President Uhuru Kenyatta from Kenya saying, as well as President Paul Kagame, working very hard in both countries to make sure that universal healthcare is made available to everybody, including the most vulnerable in society. And Paul Kagame giving some examples of some of the gains that they've made in Rwanda, the country of which he is the president. And we're hoping a little bit later on, in a short while, to hear from our own Health Minister, Palesa, Dr. Zwelim Kize.
Yes, indeed, of course, Peter, as you rightfully said, that today saw leaders adopting this high-level United Nations political declaration. This, of course, as Peter said, it is on the universal health coverage, which is now the most comprehensive set of health commitments ever to be adopted at this particular level. Peter said as soon as our very own Minister, Dr. Zwelim Kize, speaks at the summit, we'll be able to take you live back there. Taking a quick ad break, we'll see you at the top of the hour.